India's fight against tuberculosis. So, tuberculosis is not just a medical issue, but it is a mirror that reflects poverty, nutrition gaps, especially malnutrition or lack of nutrition, housing conditions, and system capacity. Hello, and welcome back to Prep Alpine, the next generation UPSC institution. We are continuing with our high yield UPSC series where we discuss some of the most important topics that have the maximum probability of being asked in your UPSC prelims, mains, and interview stages of examination. These topics not only help you to get a conceptual clarity, but also remember the facts associated with those topics so that you get the extra competitive edge in your examination. Apart from this, we also provide these high quality PDFs of current affairs which can be downloaded from our Telegram channel, the link to which is in the description below. So let us start today's topic. The topic for the day is India's fight against tuberculosis. As we all know that India has successfully defeated polio. Polio has been eliminated from India. India successfully defeated COVID-19. In fact, in the first stage of the pandemic, India was one of the most successful countries in dealing with it. बट एक ऐसी बीमारी है जिसको हम अब तक डिफीट करने में सक्सेसफुल नहीं हो पाए हैं जो कि है ट्यूबरकुलोसिस या जिसको हम टीबी के नाम से जानते हैं एंड दिस टॉपिक बिकम्स हाईली इम्पॉर्टेंट फ्रॉम यू इन GS2 perspective, especially focusing on the health, since health is a specific topic mentioned in your syllabus. So this topic becomes extremely relevant. So, tuberculosis is not just a medical issue, but it is a mirror that reflects poverty, nutrition gaps, especially malnutrition or lack of nutrition, housing conditions, and system capacity. Yes, India has made serious progress in controlling the disease, but we had a goal of eliminating tuberculosis by 2025, which currently does not seem to be met. So now let us understand India's disproportionate burden of tuberculosis. So India continues to carry the largest TB burden globally, which is kind of natural since we are the largest populated country across the world. We had lakh cases in 27 lakh cases in 2024, 3 lakh deaths, and over 25% patients. That means that 1 out of every TB patient globally was from India, and also we have the world's highest number of drug resistant TB. And what does the drug resistant TB mean? That the first generation of drugs or the first line of drugs stop working in these conditions. This is the drug resistant TB, and you have to look for some other alternative course of treatment to cure this. However, the concern is that this burden is not uniform. The urban slums, the tribal districts, the migrant heavy regions, and the malnourished populations, they are the maximum burdened generation or the maximum burdened population where the prevalence of TB remains the maximum. For them, TB is not just a disease, but it is a part of their daily reality. That means कि हर किसी घर में एक ना एक पेशेंट या एक ना एक इंसान जरूर ऐसा होता है जिसको इस कंडीशन को फेस करना पड़ता है. बट द क्वेश्चन इज कि व्हाट डज एलिमिनेशन मीन? डज एलिमिनेशन मीन दैट नो केसेस एग्जिस्ट? नो. It means that incidence is less than 1 case per million. There is 50% reduction in cases, that is, the cases should be reduced by half, and there is 75% reduction in deaths, which is very important. So, this is not just a goal but a statistical milestone. It does not mean complete disappearance, but it means that we have to fulfill certain conditions which would mean TB elimination. But why is India failing? So, we have identified 7 structural barriers that have pushed India into not being able to defeat tuberculosis or TB as a disease. The first one is COVID-19 aftershocks. That is, during COVID-19, the treatment was diverted. People could not go to hospitals. They could not afford medicines, and that is why the treatment got disrupted, and even the human resources were disrupted or diverted. Second, treatment completion challenges. Sometimes due to social stigma that people say that, oh, he's suffering from TB. People stop taking treatment. Second, side effects. Some of the people face nausea, vomiting, headache, and several kinds of things. Migration. We have to migrate for studies, for work, and economic insecurity, since that involves a lot of out of the pocket expenditure. And lastly, interrupted treatment. The third cause is rising drug resistant TB. As I mentioned, that drug resistant TB has increased, and currently we see more than 1 lakh DR-TB cases annually in India. And for this, the treatment becomes more complex, the treatment becomes lengthier. That is, generally you are treated for 6 months for normal TB, and for drug resistant TB, you will be treated for 1 year or 2 years probably. So definitely it will become more expensive. Apart from this, we see that child specific or child friendly formulations have not yet existed in India. The fourth cause is the social and environmental determinants, that is malnutrition, health conditions. As you all know that India has increased the burden of non-communicable diseases. It was even talked about in economic survey of this year that diabetes, heart risks have increased in India. So all these things delay recovery, smoking, alcoholism, overcrowding, poor ventilation, and lastly, air pollution. And no city in India, no big city in India remains untouched from air pollution. The fifth cause is medicine and supply chains. We have seen how the global scenarios remain. We have seen Russia-Ukraine conflict. We have seen Israel-Hamas or Israel-Palestine conflict. We have seen how China continues to pressurize India, how US continues to impose tariffs on India, which to some extent have reduced, especially in the context of the recent trade deal. But still, the medicine and supply chains are also a part of this global supply chain. So we have seen that some states saw intermittent stockouts of essential drugs, and essential drugs mean that they are the most important drugs without which the treatment cannot be done. And in cases of TB, even if you interrupt the treatment for a few days, say maybe 5 days or 10 days, then that leads to a larger failure at the mass scale. Sixth is slow uptake of preventive treatment. People hesitate. People fail to accept that yes, we have developed TB. Yes, we need treatment for it. There are latent infections that remain untreated. And lastly, the uneven state level capacity. The capacity of medical professionals or the health system that you have in Delhi or probably in Kerala, you do not have the same health system or the capacity in Bihar or in Jharkhand. So there is unevenness of health system across India, which leads to underreporting, undertreatment, etc., etc. So what are the things or where are the areas that we have made progress? So first of all, we have achieved near universal treatment coverage, that the coverage has increased from 50%, approximately 50% in 2015 to more than 90% today. Active case finding and better referral systems are there. Now there have been shorter and all oral regimes. All oral regimes means you are given the tablets and you have to swallow them. There is no kind of injection or anything involved, and shorter regimes. That is 18 to 24 month of drug resistant TB. Then we have technology that has helped us extremely. We have portable X-ray machines. We have AI-based interpretation. We have a national 100-day campaign, which is known as the Ni-kshay campaign. We have the Ni-kshay platform, the digital platform to track the TB cases across India. Then we have a well-developed community support system that involves the Ni-kshay Poshan Yojana, the Ni-kshay Mitras, the community engagement, etc. Next, we have state level innovation. That means the Tamil Nadu's triage model, which identifies the vulnerable patients early. Several states are also planning for micro planning and trying to implement it. But this is not enough. We need to do several things so that the target of 2025, which we have failed to achieve, must not be failed or must not be failed in 2030. So, first thing that we need to do is scale early detection and active screening. Second thing, guarantee a zero stock out of drug supply chain so that the treatment remains uninterrupted. Third thing, universal preventive treatment. Fourth, we want to improve treatment completion, that nobody stops their treatment in between because that is a breeding ground for drug resistant TB. Fifth is we need to address social determinants. We need to see that migration is addressed. We need to see that malnutrition is addressed, the non-communicable diseases like diabetes, etc., tobacco control, air pollution, all these things are improved. Next, we need to strengthen the private and public sector engagement. And lastly, we need to focus on micro planning, that is district specific micro planning, so that the target of elimination of TB by 2030 gets achieved. So that's it for this video. If you want more such videos, please subscribe to the channel and keep watching Prep Alpine. Thank you.